Hi, I'm Tamsin Marshall from Beauty Goss, and I'm here with Dr. Teresa Cattin at Faceworks. Now this is the first time I'm ever getting Botox, and I'll probably get it again, but anyway. I've chosen Dr. Teresa Cattin because she is the best in the country. She's been teaching other doctors to use Botox for over 10 years. She's on the advisory board for Botox and Juvederm, plus she's the president of the New Zealand College of Appearance Medicine, so I'm in really, really good hands.
Hi Tamsin.
Hi.
It's a big day.
Yes.
Okay. Are you nervous?
A little bit.
To start with, have a look in the mirror and just tell me how I can help.
Okay, so now that I'm nearing my mid-30s, I'm starting to notice that the lines on my forehead are just becoming a lot more noticeable. And I've been a bit tired. I've got a 14-month-old girl. I've been working lots, and I just feel like any minute now these are going to take over.
Okay. So you've got the lines on the upper forehead that you're not happy with, and then you'd also like, you're also feeling a little tired.
Yeah.
So if we did something like this that gave you just a little bit of a lift, I think that would really freshen up in a very subtle way. Do you agree?
I totally agree.
You've got a great shaped eyebrow anyway, so we certainly don't want to change that, but we do just want to lift the brow just a millimetre or so.
Because I have got hooded lids, which drives me to distraction with makeup.
Well, that's great, because the little lift that we're going to get with Botox will also help lift that. Just that tiny little bit of loose skin that you're starting to get there. Now, what you're asking me to do today is difficult. Because these lines here are created by the forehead muscle, and you've created those lines by lifting your eyebrow. Now, if I put Botox, a lot of Botox in here, I could give you a very smooth forehead, but you would look ridiculous. You wouldn't be able to move your forehead, and your brows would drop like that. So we have to compromise a little bit. So what I suggest we do is just put a fairly low dose across this muscle here, which is going to soften and lift, and then a very small amount along these upper lines, not to take them away, but just to soften them a little bit. So it still looks very natural, and so you've still got a little bit of movement going on there.
Cool, that's good. And under the eyes, is that the same thing, or is that something else, or?
You're talking about the little shadows that you're starting to get under the eyes?
Yeah, and those soft little wrinkles that love to come out when I smile.
Look, you're starting to get a few little crow's feet, and it's mainly when you smile. So at some point you might want a little bit of Botox to soften there. Looking at the more tear trough area, the shadowed area there, it's more from loss of fat through there. Your face is probably getting a little thinner as you get older. We all lose fat in the wrong places. That's not so much a Botox treatment as a Juvederm treatment. So perhaps we'll do your Botox first. I think that's going to give you quite a lift. Then after that we can talk about putting a bit of Juvederm through there.
Cool.
Does that sound okay?
Yeah, that sounds good.
Right. Do you have any questions at all about Botox?
No.
You're quite comfortable?
Yeah.
Okay. I'm going to get you to sign a consent form, read and sign a consent form, and I'm going to take some before and after photos, and then we'll do your treatment. Okay?
Thank you.
Okay, I'm just going to wipe your forehead, and it's going to be a series of tiny little injections, pretty much like a little insect bite or plucking your eyebrows. Okay?
Okay.
Now, what I'd like you to do is just frown for me. Okay, and now relax and close your eyes for me. Okay, there we go. A little prick coming now.
God, I hardly felt it.
Good.
It is like a little, sort of like a little sting, but it's not.
And then it stops?
Yeah. But a little, it is. It's like plucking your eyebrows.
Good.
Well, actually, I think plucking your eyebrows is worse.
Good, okay. Frown again for me. Lovely, relaxing. a frown for me. Lovely, relax again. Good.
So
Nearly
do you
finished.
kind of hold it in place? Is that sort of...
If I lift the skin a little, it's just more comfortable for you.
Yeah.
Okay, frown again and relax for me.
I can see why this is a lunchtime treatment.
It is.
You can just get it done and then go back to your desk.
Frown again and relax. And last one. One more frown. Lovely, and relax.
So how long will it take before the full, before it takes full effect?
Right, you're not going to notice anything for a few days.
Yeah.
And the full effect will be at about a week.
Right.
So I need to see you 2 weeks' time.
Yeah.
And then we'll have a look at your result.
Yeah.
Compare your before and afters and make sure we're both happy with it.
And I think I've read things like you're not meant to get a facial, or is that
No facials today,
Yeah.
no massaging, no sort of marathon training or anything.
Yeah.
Just have a quiet day.
Yeah.
From tomorrow, do what you like.
Wow.
So that was the frown, and now I'm just going to do a little bit on the forehead,
Okay, cool.
just to soften. So for this one, could you please raise your eyebrows for me? That's great, okay.
It's a little bit stingier, but it's still not really
Good.
that bad.
You sound surprised.
Oh, I know. I think I was expecting it to be a lot more painful. A lot more painful, actually.
Just raise again for me. Lovely, relax.
Because it's such a bony part of your body.
It is, but these are tiny, tiny little dots.
Yeah.
That's it.
That's it.
Well done.
Wow.
So you've got a few little bumps,
Yeah.
which is just from the saline that the Botox is in. They will go within about 10 minutes.
Yeah.
No bruising. So no one needs to know.
That's even better.
There we go.
This is the last time I'll be frowning for a while. Amazing. I just thought it was going to be so much more painful, but it's just like a tiny little sting, or I honestly think getting my eyebrows threaded hurts a lot more than this. It's really cool. Hi, so it's been 2 weeks since my treatment and I'm absolutely thrilled with the results. I can't believe it. I can lift my brow, but I can't frown, which is great. Kind of keeps me happier. But it also coincided with a really busy time when I was on deadline for the magazine and attending launches. I had a couple of people tell me at a couple of launches that I look as fresh as a daisy, which I was thrilled to pieces with because I was absolutely shattered, averaging about 5 hours sleep a night. And but it was great because I felt, my eyes felt wider and I felt fresher. It was perfect. So I'm here to talk to Teresa and finish the consultation.
Hi, Tamsin. So tell me, are you happy with your treatment?
I'm absolutely thrilled. I can't believe it. I thought, and I was really worried, that with my hooded lids and you know, that sort of thing like that, I might get that kind of effect. But it's almost been the opposite. Is it possible that it's
that your brow has
lifted?
Exactly. And that is the secret of Botox.
Yeah.
That's what makes us look fresher, because the brow has actually lifted and opened up that eye area.
Yeah, because I've felt it, even though I've been really busy and tired and stressed and, you know, on deadline and all that craziness. And I went out for dinner with my friends and they were like, wow, you look really fresh. No one would think that you sleep deprived at the moment. And
you look fantastic.
Yeah.
You look really good.
So what do I do from here?
Okay, if you like the result and you want to maintain this, I will need to see you probably 4 times a year.
Okay, so every 3 months.
Every 3 months.
Okay.
Come see me in 3 months' time.
Great. I can't believe I haven't done this sooner.